having that cardio protection because majority of us actually have low good cholesterol. And about a third of us have high triglycerides. No symptoms. Wala po siyang symptoms. Pag mataas ang LDL cholesterol mo, kahit na 300 po yung LDL cholesterol na yan, and I've had some patients with genetic mutations that cause their LDL to be high, there are no symptoms. Some may present with physical stigmata, but again, small percentage lang po yun. Ibig sabihin, by the time lumabas ang manifestasyon ng dyslipidemia, heart attack o stroke na po yun. And that's the scariest part about dyslipidemia. Because if you don't look for it, you cannot treat it. And its first event is going to be a heart attack or stroke. And I want you to understand that therapy can still be diet and lifestyle modifications. Having said that, if the dyslipidemia as a risk factor already causes disease, and that is ischemic stroke or coronary artery disease, then absolutely. We have a lot of centers that will look particularly for coronary artery disease as a screening tool. Kaya po marami na ngayong mga executive check-up. I think when you guys go to HMOs or with your own institutions, corporations, if you're an employee, they're actually pushing now for executive wellness checkups yearly. And part of it includes a screening tool that allows us detection of coronary artery disease. And that's a treadmill exercise test that above 45, above 40, depending on which institution you're with, will recommend it as a yearly test. Kasi po, this is the best screening tool to be able to detect if you have coronary artery disease. Aside from that, we do have other management options, and these are treatment. Oral therapy is still the treatment of choice in patients with dyslipidemia, particularly high LDL cholesterol. Ito po yung mga statins. These are first-line therapy. We have a second agent on top orally that will treat high LDL cholesterol, and that is ezetimibe, also available in the Philippines. And of course, we have a third-line agent that is now being introduced to us by Zuellig, that is an injectable in very high-risk individuals with still high LDL cholesterol, kahit na yung oral therapy hindi na nag-work, so that we can give an injectable to lower LDL cholesterol in patients who have already had a stroke or who have had a heart attack. So we have a lot of armamento for treating dyslipidemia. We presented the European guidelines for the management of dyslipidemia. And I want you to understand that whether we look at international or local guidelines, there is no one diet that we're promoting. Not ketogenic, not intermittent fasting. We look for a well-balanced diet. Having said that, lately there was a huge meta-analysis looking at supplements. Lahat po niyang supplements na yan. Pati vitamins kasama. And universally, there is no benefit for cardiovascular health when we talk about supplements. Understand that when we look to clinical trials, supplements, very difficult to include in a clinical trial kasi po una, wala masyadong funding. Pangalawa, to attribute all the benefits in one patient to the supplement alone. Yung iba po kasi pag nagsusupplement, nagda-diet na rin yan, nag-exercise na rin yan. So hindi mo masasabi dahil lamang dun sa supplement. Having said that, it probably doesn't cause harm, itong mga supplements. Again, it depends on which one, no? I do caution my patients about Bangkok pills, about fen-phen diet pills, because it has cardiomyopathy, cardiotoxic effects. But other supplements that they take, yung mga dahon-dahon, yung mga pinapakuluan, well, that's different. No? Liposuction is not so much a supplement, but a treatment. So, wait, let me finish first, sir, my train of thought. So, having said that, if the supplement makes you feel stronger, if that supplement will make you take the medicine I have kept you on, if you feel better overall with the supplement, then as long as it's not harming you, by all means you can take it. Again, not the pen diet pills and the ones that are causing you to lose significant amounts of weight. When sir was asking about liposuction, that's different. No? I do want you to understand that liposuction has been looked at in clinical trials. And we've seen the weight reduction that comes from liposuction, from bypass stomach surgery, where people significantly lose weight. And there are health benefits as long as it is guided by a physician. So, ibig sabihin, pagka meron kang magandang medical team on board that guides you through it psychologically, physically, for diabetics who undergo significant weight loss, then there is still a